I'm going to hit record first because Bernie has his note taker asking me to approve him to record. Sometimes when I do that before I record, then mine doesn't work. So just so you guys are wondering. It is 11:30, but I think a few more folks are trying to get on here.
Yeah, I'll wait a couple minutes. We usually get some latecomers, couple, 3 minutes in, and don't think we're going to have a real long meeting today, so I think we can give it a couple more minutes.
Okay. Just so you know, Lindsay from Mercy Behavioral Health could not make it. I think I told you that previously, but she did send me just a real small little update that I'll read out loud when it gets to her section.
Okay. Cheryl's here. Okay, good.
And I don't have an update because the Roseburg Homeless Commission hasn't met yet because of how the month fell with the days. They're actually, if they meet, it would be next week. Gary, do you know if they're going to have a meeting next week?
I'm sorry, I didn't hear what you said.
Oh, the Roseburg Homeless Commission, are they meeting next week?
I don't know.
Okay.
I'm not part of that meeting, so I don't know.
Okay.
Okay, if you're ready, Corey, let's go ahead and kick it off. And we might have some other people coming in later, but that's fine. We can catch up with them. I'm the chair, Alan Hobson. I'd like to have everybody introduce themselves, if they will. Anybody? Dane?
Sure, Dane Zahner, he, him. I'm with HIV Alliance and also help with the Connecting Point Initiative. And glad to be here.
Okay, next on my screen is Chief Kloppenstein.
Gary Kloppenstein, Roseburg Police Chief.
Thank you. Joaquina Madison.
Joaquina Madison, lead peer for ADAPT in Roseburg.
Thank you. And Christy Hellman.
Hi, I'm Christy Hellman. I'm Assistant County Counsel.
Thank you. Eric Fromdahl.
Eric Fromdahl, Director, Douglas County Juvenile Department.
Thank you. Janelle Kohler.
Janelle Kohler, Executive Director for the Housing Authority of Douglas County.
Thank you. Ellen Noah. Is she here?
Yeah.
Oh, there she is.
Juvenile Department.
Thank you. Teresa Roche.
Hi, I'm with Teresa. I'm with WorkSource, and I'm a career coach.
Okay, thank you. Emma Thornton.
Hi, I'm Emma with UCAN AmeriCorps, and this is Elizabeth and Elsa.
Thank you very much. Yeah. Cheryl.
Hi, Cheryl McDonald. I'm the Program Director for Crisis Services at ADAPT.
Very good. Jesse Spain.
Hey, good morning, everybody. I'm the Regional Director of Painted Horse Recovery Center in Roseburg here.
Thank you. Thank you. Heather Carter.
We couldn't really hear you, Heather. We heard your name and then it kind of faded away after that.
Let's try this way.
Perfect.
Heather Carter, the Care Navigation Manager at Umpqua Health Alliance.
Very good. Thank you. Debbie Hollander.
Debbie Hollander, Community Engagement Coordinator.
They cut off at the end, but she's also Umpqua Health Alliance.
Okay. Okay. I kind of assumed that, wasn't sure. And Sarah Holcomb.
Yeah, hi, Sarah Holcomb with Oxford House. I'm the outreach worker for Southern Oregon.
Thank you. Okay, so we got everybody introduced, so I'm kind of cool with that. can I have a motion to approve the minutes from our March 25th meeting?
I'll put forward a motion to approve the minutes from the
I'll
March
second that.
Thank you,
meeting.
Dane. Thank you.
I'll
Sarah,
second that.
seconded it. Okay, thank you, Sarah. All in favor, either say aye or raise your hand.
Aye.
Is there? Thank you. Any noes? Motion passes. Thank you. So we'll move on to our first point, connecting point update. Zane, you're up.
Sure, I can't share my screen. Sorry about that, but we had a total services of about 274 people. 123 of those were male, 151 female. No ages. Well, actually, I'm sorry. Ages that we collected was 132. We had 37 that identified between 18 and 30. 68 between 31 and 50. 25, 51 to 64, and then we had 2 people identify as 65 plus. We had 33 showers. We were missing a few of those. I'm working with Reggie and Mark to get those. We only got 3 sheets, so I know we did a lot more showers than that. The people that we could duplicate, we had 79 that were turned in with an ID. 74 of those when we unduplicated that, so we only had 5 duplications. 47 of those were male, 27 female. We had 1 non-binary. Naloxone was the #1 item out there, 182 doses distributed. Other resources, which were just kind of adapt. Mary does a lot of different resources, so I just group them all into one. 151 other resources. We did wound care kits of about 117. Sanitizer 66, hygiene about 65 clients, next services 54, food resources 50, pet food 47 people, and then socks 49, fentanyl test kits 31, condoms 14. We had testing of 8 people. That was HVC, HIV, and syphilis screen. There's been some of the areas have been kind of slow. The Dream Center, and it might just be the season, I'm not sure, but the Dream Center has had kind of low traffic, and we've seen a little bit of an upswing in the Seventh-day Adventist area, but that's still fairly unstable as far as seeing like 2 to 3 people on a weekly basis, mainly for the shower resources. But I'm happy to say Myrtle Creek's going well, and then the drain has also been going well. So we're also working on Reedsport and getting a collaborative team over in Reedsport to help support people. We probably won't have a shower trailer because that's a long distance for the ADAPT team, and the ADAPT team out of the Coos Bay North Bend might be coming over to support that versus sending people from Roseburg. Any questions on that data? We have conveyed, I know that we're trying to get people to discourage, like there were indications of multiple tarps, tents, sleeping bags amongst people in the last sweep, and we want to encourage that. Kind of fine tune those items to people and not, make sure they really need it, but hoarding is something that we're seeing out there in the camp, so we want to make sure that a person really needs the resources we're giving them. Some of those were in boxes, and we've communicated that too, is like, please unbox these, so a kind of unnecessary letter that's out there. And just anything we can do to dissuade with people. The team's also trying to really diligently collect sharps as we're going through the parks and keep them more stable in one location. But those are things that we're trying to do to just help support the community. Anyways, any questions?
Not on the statistics necessarily, Dane, but were you, if my memory is correct, and maybe it's not, were you going further south than Myrtle Creek?
No, not right now.
county?
We're going to just Myrtle Creek is the only southern area. I mean, at some point in time, we would love to maybe, go into Riddle in that vicinity, into some other locations, but right now we haven't been expanding. We're just kind of growing the Myrtle Creek, growing the drain, and then getting into Reedsport, because Reedsport has indicated always wanting some more resources, and we got a great collaborative group over there that's really trying to encourage, like, getting the treatment options there, getting harm reduction, and whatever we can bring to the table.
Okay, thanks, Dane. Any other questions for Dane?
So it's not a question, but I calculated his total for services for the first 3 months. So for services, they provide 3,373.
Very
January
good. Thank you, Corey.
Yeah.
And by the way, I did not introduce Corey Tate, our coordinator, but I assume everybody already knew her. So,
Yeah.
Corey,
And
welcome,
Sarah,
Corey.
And then Sarah Wickersham just joined us with Douglas Cares.
Okay. Hi, Sarah. Okay. Next on our agenda is the ADAPT Integrated Healthcare Program highlight and successes from Cheryl.
Hey, yeah, I will start with impacts. They were busy in Q1. They had 848 services during 522 encounters. Our cohort is up to 699 cohort members, with 172 of those meeting that current criteria. So they have had 4 or more incarcerations during the last calendar year. So we do focus our services on the 172, but we also monitor jail data to see if former cohorts are getting close to that benchmark again, so that we can outreach them, hopefully before they meet that criteria. We had a recent success that I just wanted to share because I think it really demonstrates exactly what Impacts is meant to do. Subject 597 has only been engaged with Impact since November of 2024. In the year prior to that, they had 6 incarcerations and a handful of ED visits. So we engaged with them in November for the first time. In December, they had 1 additional incarceration and an additional ED usage. But then in January and February, they went to inpatient substance use treatment. So this is one of those cases where we were able to go into the jail, arrange for the ACM while they were incarcerated, and get them very quickly into substance use treatment. They spent a couple of months there. They discharged in March. And then we used our funds to pay for their move-in costs for supported clean and sober housing. And then they started the job search. And so they were able to find employment pretty quickly. They had a vehicle, they had a driver's license, but their barrier to employment was transportation. They needed an SR-22. So we used Impacts funds to pay for a month-to-month SR-22. And then they had a barrier so they had this vehicle, they had employment, they had insurance, they were great to drive. Their vehicle's tires were too bald. So we were in the process of purchasing new tires for them when their car got towed, they got impounded. And that was not a success, but where we found the success is this person managed to stay clean and sober throughout that really distressing process. And so I think that, getting your car towed or having something major happen with your transportation, that's enough to send a lot of us into a spiral. This person had built up their distress tolerance where they were able to remain engaged with us. They had a real big disappointment, but they kept going and they kept using their supports and they kept clean and sober and they shifted and they are able to take public transport to work. They're still employed. They did not deviate from that path. And I think that is just exceptional. So super proud of that person. Resolution rooms have been as busy as ever. We are sort of working out some kinks in the system to not disallow people, but really just ensure that people are there with a good, with the ability to take care of themselves. We had someone come into the room and maybe it wasn't the best fit and there was some damage caused to a room. But I will say after almost 2 years of use, this is the 2nd time we've had major damage to the room. So I think that's a pretty good track record for those resolution rooms. Let's see. I had some mobile crisis data. Mobile crisis has been busy. I don't know if the group knows this, but there's actually 2 crisis teams in Douglas County. There's mobile crisis that goes out to that initial crisis. And then there's the Madrone crisis team, and they do all of that follow-up care. So it's been a busy quarter for crisis services. There's been a number of suicides. There's been a couple of different fatal incidents. Over this weekend, there were a number of fatalities that impacted the community. So we had mobile crisis going out on those initial calls, and then our Madrone crisis team who does those really in-depth community supports afterwards. So if you are working with someone who has had a fantastic experience with any of our crisis teams, I would love to hear details of that so that I can pass that on to our teams. They are out there in the community doing some really tough work because they love this community. Most of them are from here and feel really strongly about the work that they're doing. So I pulled data for Q1. I haven't had a chance to separate the total calls from the in-person calls, but for Q1, there were 596 calls for service for mobile crisis. And I'll have better numbers about how many of those were in-person versus telephone only. And then of those 596, 86 of those were responses for youth. And so we also will have some good data about the number of youth who were admitted to our stabilization services and the outcomes of that after their mobile crisis encounter. Sobering Center was also busy. Q1, there were 72 admissions. There were some duplicate admissions, and I'll send Corey out the data attached to that. We are making some changes in our policies over there. We have had, since opening to voluntary admissions, we love voluntary admissions, but we've also noticed that individuals will present to the Sobering Center and say, I'm intoxicated, I'd like to come in. They come in, they eat something, and then perhaps leave very quickly. So we want to, we don't ever want to turn someone away, but I think that we need to refocus on the importance of individuals need to be unsafe to be in the community in order to be admitted to Sobering Center. So we've changed our policy just a little bit to incorporate more of that and then be able to present people with alternatives in the community if they don't quite meet criteria for that. So do you guys have any questions for me?
I know that I had asked this question before, Cheryl, but I asked about voluntary admissions, and you brought up a good point that sometimes the voluntary admissions are for other things other than than being intoxicated. So I can understand the problem that's happening there now.
Yeah, and I think we are sometimes creating a scenario. We had a scenario last month where someone did not meet criteria. They did not appear to be under the influence. And so they went to a nearby mini mart and bought a beverage and came back a few minutes later, and they then met criteria for alcohol consumption. So we want to reduce that. We really want to, like, I love that people want to come in and they want to talk about recovery. But we need to tighten that down a little.
Yeah, very, very much understood. Any other questions for Cheryl? I'm always impressed, Cheryl, with the numbers that you give out. Very important work that you're doing, the ADAPT is doing. Thank you very much. Next on our, so Lindsay is not here. Corey said Lindsay's not here, but she has some updates from the Mercy Medical Behavioral Health Unit.
Yep, she was on a long needed vacation, so she was coming back from her travels and couldn't make it today. What she told me via email, she said today is 1 day shy of their 11th month anniversary. They passed their joint commission inspection, and there have been a few days where they have actually been operating at full capacity with every patient bed filled. She said they're happy to take collaborative information from any entity, which is helpful so they can call ahead and speak to the emergency room to also give them a heads up, as well as the psychiatrist that is on duty. So part of that response is because I asked her to clarify their referral process. So from there, she went on to say they refer everyone through the emergency room and cannot take direct admits from the community or outpatient settings. To meet criteria for admission, they must have a medical screening that includes an ER visit and clearance. They can accept patients from any ER and have taken patients from all over the state. They can also take patients who have been seen, treated, and cleared from other hospital settings, such as ICU or PCU. The medical screening can help rule out and/or identify any medical needs. So that was her report.
Thank you, Corey. But you did say that they have been pretty much at capacity?
Yeah, she
Most
said there were
time
a
here-
few times they were at full capacity. So they have, I think they have 14 beds there, so they were full. Whereas before, when she's reported, they usually have 1 to 3 beds open at any given time. So they've
And
seen it
there's
increase.
still, is it still a short-term facility though, isn't it?
Yes.
Thank you, Corey.
Yep.
So open up for any other updates from any other people on our roundtable here. If anybody else has anything they want to share that's not particularly on the agenda.
I think Stephen Campbell was originally on the agenda to share information about our community capacity building funds. I actually was asked if I would go ahead and share that information, if that's okay with you guys.
Yes, that'd be
Sure.
great. Yeah, he sent me an email. He wasn't well. So
Yeah. So they're like, can you share it? I'm like, sure. Let's see. Oh, I need to send sharing request.
there we go. I hit allow.
Thank you. Okay, so I'm going to share information. So it's our HRSN Community Capacity Building Funds. What is our Community Capacity Building Funds? It's to support our community partners in an effort to expand our HRSN services so they can become service providers. We've got climate, housing, nutrition, and outreach and engagement are the 4 areas where we have services. Right now we have climate, housing, and nutrition a little bit, and then outreach and engagement is coming. The statewide, there's $56 million given to CCOs for these to expand these services. And we were allocated $2,024,611. So who can apply? Basically, anybody that can do HRN services, so housing, nutrition. You have to have strong community relationships, and you also have to have systems in place to be culturally and linguistically inclusive, trauma-informed, and you have to meet CMS requirements. There is more information on the OHA website. I'm going to post a bunch of links in the comments when I'm done. I'll give you guys links to the application, the state website, along with some more tutorials and stuff like that. Our funding priorities for 2025. We want to partner with local providers in Douglas County or neighborhood areas who can consistently accept referrals for new clients. We want to build further capacity for our HRSN housing service, particularly rent and utility assistance and tenancy services. And then we're looking to build capacity for our forthcoming fruit and vegetable benefit. We don't have an exact date for that one, but it's coming up the end of this year or beginning of 2026. We do not need people to provide climate services or medically tailored meals. We are covered in those areas right now. We'll gladly consider those applications, but they're not going to be a priority. And this is just an overview of the timeline. So we're accepting applications now until the 31st. And then we're going to review them. And then hopefully by October, we'll get the funds distributed. Yeah, so that's it. again, I'll post all these links in the website and the chat. So if anybody wants more interested, there is a webinar that has a lot of information, and please reach out to the provider relations team. This is their email. I'll post that too. They could answer any assistance filling out applications or anything like that. So, and that is all.
Can you share the PowerPoint with me so I can mail it to the group?
Absolutely.
Thank you.
Oh, that's very good information, Debbie. I appreciate that. And the fact that there's so many of our group that can share that too. I'm sure that they probably have some questions or some needs that you can provide. So thank you. Any other questions for Debbie? Okay. Any other roundtable updates from our group that want to share anything that's going on?
I can share that I went to Jesse Spain's 2025 Spring Summit at Canyonville at Seven Feathers. So Daniel Bauk is our public defender, myself, Christina Donahue, which is the drug court coordinator, and Robert Wilson is the mental health court coordinator. The four of us went down there to talk about our programs that we provide and had some good feedback from the group, and just kind of shared our grants, the different things that we do and our roles, how we help folks through the processes to get to graduation and then beyond. I just wanted to share that. It was a great conference, and we appreciated Jesse's invitation to be speakers.
That's a very good idea there too. Jesse, I know that you've been in the news a lot lately, and that's very, 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 very helpful that you're providing those services.
Yeah, thank you, Corey, for showing up with your team. That was a really great presentation. I feel like the event was really great. Connected with a lot of community partners. I think we had community partners from 7 counties who were there. So it was really amazing. And right now I've got 3 or 4 new people in the center. They're in there doing homework. I mean, it's just really amazing. That's exactly what this space is for. So thank you again, anybody who showed up, and thank you, Corey.
Thank you. Anybody else have any other updates that they want to share with us? Okay, if not, going forward, Janelle, housing updates, Janelle Kohler.
Yeah. From the Housing Authority side of things, our Section 8 voucher program is at a standstill right now. It'll probably be a few months before we get that moving again. And when we pick back up, we'll be looking at applications that for people that applied around September of 2023. So it's kind of what you can expect on that program. All of our wait lists are growing longer. The more we purge, the more they grow. So usually we have openings at Orchard Knoll fairly quick, but that wait list is getting longer as well. So it just emphasizes the tight market out there. And if you have clients you're helping, just to get them on the wait list. Sometimes it seems daunting, but sometimes when we go to pull from the wait list, we can go through quite a few people because they might have found other resources for their housing, and all of a sudden, we're able to get through quite a bit more applicants than we thought. So you just never know in that sense. So that's what's happening on the Housing Authority side of things. As far as HTAG goes, our partnership of different community agencies, of which several of you are part of, which I appreciate, met last March. We will meet again tomorrow at 11:30 just to network and try to discuss ways to resolve issues around the homeless population. And when we met last, we had, let's see, looking down, we had a tour planned for a accessory dwelling unit manufacturer down in Grants Pass, which did happen last Friday. It was a great little tour. The product is really neat. They have a variety of products down all the way from a small shelter with absolutely nothing in it. It would just be basically almost like a container, but they're not a container. And individuals, there's some other places around the nation that have used those for homeless shelters, and where they have a centralized bathroom or kitchen or something, and this is just a roof over someone's head where they can sleep. And then it goes up from there to pretty elaborate small accessory dwelling units, and they're actually labeled RVs. So, but there's some that they use for offices, portable office spaces or small housing. And so, some pretty neat ideas, and they collapse down to a pretty small storable space. The price ranges significantly anywhere from, $7,500 up to $100,000, depending on what level of unit you're getting. But it was nice to see that resource locally and to hear what they're doing. They're going to be at the Oregon League of Cities here. In the end of May, there's the conference over at the Mill Casino, I believe. So they'll have a demo there. If any of you are going, then take a look at it. So that was interesting to see. They're also involved with some different planning down in Grants Pass that I'll be monitoring to see because how they're handling some of their homeless population and ideas that they're working on to not be a cost burden to the city. So I'll be paying attention to that. Let's see, we had some movement with members working with Virgil Osborne on hopefully some funding for a pilot ADU program or yeah, so that'll be interesting. I haven't heard any updates to see if that made it through any ways and means committees and things like that. So but it was nice to have that networking as well. Forest Glen has kind of had its rocky patches over the last couple years, and as far as we know right now, it's business as usual down there. So we're just again monitoring that to see how we can best support that apartment complex. There's another apartment complex in Glendale that had some subsidized housing where the contract's coming to an end. And so the hope is that property transitions to some tenant protection vouchers through our agency. And we're just watching and monitoring that as well, because there's some compliance items that the current owner has to do in order for that to happen, for us to be able to provide those tenant protection vouchers. So it sounds like that's still being worked on, and they did extend their contract through, I think, the end of June. So hopefully there won't be any displacement or lack of subsidies for those families in that apartment complex. We discussed just some of the resources for flooding that the county had provided, and just networked that out to try to make sure people had that information as well. So that is, and of course, what Dane already said about some of the immediate needs and wound care kits and stuff like that, that his agency and other agencies are providing, and all the hard work they're doing. So, so thank you to everybody that's participating in that. And I think that's my updates.
Okay, thank you, Janelle. Any questions for Janelle? I saw something in the paper a couple days ago, Janelle. I don't know whether it affects housing authority or not. The Rose apartment building. Is there any ideas about how that's going to affect our housing, the amount of housing we can provide?
Yeah, it is, because it's affordable right now, and that contract is expiring. Plus, as you noticed, I'm sure that I haven't seen the article, but I'm assuming it said it's for sale. And so I'll have a meeting next week to see with some possible partnerships to see on ways to preserve that. So it definitely is, a concern. We want to make sure that affordable housing stays in the housing market as affordable. So I just learned of this, so yeah. I'll have hopefully more information to come.
Okay. Yeah, I assumed that was just the starting location on that particular situation, but it would sure be nice if that affordable housing stayed available. Any other questions for Janelle? Okay, we will round table for other organizations with housing updates. Anybody else having housing updates that they want to share? If not, we'll go to our community presentation, and our chief, Roseburg Police Chief Eric Klopfenstein is with us.
Good afternoon. So Corey, if you'll give me a verbal when I get this going and make sure I'm sharing properly.
Should ask me to allow you. Should be something to click. I haven't seen it come up yet. Maybe
Did that do it?
Says you're starting to share. It hasn't shown it yet. Sometimes it takes a moment. There it goes. You're good.
All right. So you're seeing the slideshow?
Yep.
Yes.
Yep.
All right. So I'm going to kind of run through our camp cleanup process and kind of a little bit of historical as well. Some of the slides, there's just a lot of information, and I kind of put them on there. So when the PowerPoint's shared, you guys have that information if anyone's interested. Prohibited camping in Roseburg has been in place for a long time. I feel like it's maybe back since the late 90s when it first came out. But in 2019, we had some federal rulings that really caused things to be changed. But prior to that, we would issue citations for $1,500 citations. They weren't really 15. That was the bail we put on them. The judge could make it anywhere from 0 to 1,500 or nothing. But we would write the citation for 1,500. And prior to 2019, we had about 20 to 30 campers, and the public really saw probably maybe 10 of those in different spots because they could be pretty well hidden. So we had to transition from kind of enforcement and transition over to abatement. So what we found was when we leave the camps alone as a city, when we're leaving the campers alone, they bloom at a rate they grow exponentially. They get so large and entrenched, and so much damage happens to sensitive environmental places that we have to address it. So during the pandemic, we were restricted. Of course, CDC recommended we leave them alone. OSHA had recommendations, and then of course the governor's executive orders restricted us as well. So
Gary,
our camps.
Sorry, Gary, but your slides aren't moving forward. It's stuck on the first page.
It is?
Yeah, because I've seen your slides. I knew you were moving forward, but we just see your first page. Sorry,
Well,
you're on a good roll. I didn't mean to interrupt, but
no, thank you. Okay, so let me try something else. Let me try to stop sharing and come back if that's okay.
sure.
All right. I'm going to move this down to your slide here. I have 4 screens and they are not working well together here. Okay, let's try it again here, see what happens. This may be a you thing, Corey, here in a minute.
That's fine.
Wait a minute. Maybe that's my problem.
There we go.
Okay, so did something move?
We got the first one.
And we
Didn't
just
go
see
to
the
this. Now, do you see the second one?
No.
Yep. No.
Well, I may need you to do it for me, Corey.
Okay, go ahead and unshare yours and I'll try to share it through mine.
Sorry about that.
No problem. Okay, So there's your second slide. Does everyone see that?
Yeah.
I see
Yep.
it. Okay, go to the next one. So our camps ballooned from 20 to 30 after the pandemic to hundreds. Well, we had about 125 right afterwards, but then it bloomed even more, and it just kept growing. In last year, 2024, we posted and cleaned 1,440 or 62 camps at 55 different locations, and we collected over 459,000 pounds of trash, which was taken to the landfill. So it just goes to show how much was out there. Go to the next one. These are some photos of our homeless liaison officer. We, as a police department, I had to assign a temporary duty assignment for homeless liaison officer. It's Officer Chavez. He does a really good job. He's got a good balance of trying to help people and also trying to hold them accountable. These are some of the camps out at Deer Creek Park and some of the cleanup efforts. Next slide. So for the abatement process, when we had to swap from the more of enforcement back to abatement, which we still are doing now, we identify the campsites, and that comes in from the public. We get complaints all daily. We get all the time we're getting complaints, but we'll kind of collect those, see where the worst areas are, and then visually we can tell as well. But sometimes things are a priority, such as Gaddis Park, where the baseball is going to be playing, and different areas like that really have an impact on operations. And so we identify the camps, and then we post them with a camp clean. We post them for camp cleanup. Next slide. And that process is pretty intensive. So we go there to a camp, we take photographs, we report the location and the information of the name and all the information we have to UCAN, the name of the person, to give UCAN the opportunity to come out and make contact with that person if they so choose. We issue citations for unrelated criminal behavior. Sometimes they've dug into the bank along the river and made a real mess into the landscape, or it's super offensive with the littering. So we'll take enforcement action if we need to at that time. We also provide the campers with yellow garbage sacks. You may see those out there, almost like the ones along I-5. In fact, they might be the same type of sack. And then we request they clean up their own trash, and they do sometimes. We have two right now, 5-yard dumpsters out at in Stewart Park. I'm sorry, in Deer Creek Park, which we service weekly, and so those will fill up. Officer Chavez answers any questions that can be asked. We have the Douglas County resource pamphlet that's always available to hand out to disseminate to them if they choose or they need it. And then for every campsite, each campsite, there's a police report written. And so during one of the cleanups, they actually did 110 campsite postings. So that was 110 police reports that were written for that. And if you can imagine, even if you're fast, that takes hours. And then we wait a minimum of 72 hours to clean a camp. And usually it's 6 to 7 days. So usually we post weekly. So we post one midweek, and then midweek the next week we do a cleanup. So they usually have more time than that. Next slide. We contract with Douglas County Work Crew for cleanups. That has been very valuable for us. We couldn't do it without that. They've not been available for the last couple of weeks, but thankfully we've also had some volunteer helps. There's helpers. Volunteers come from different areas and different reasons, but there's some come from Bernie's camps as well that have been very helpful during this time. Roseburg Disposal will drop off 20-yard dumpsters, and we will fill usually 4 to 6 during a cleanup. At our highest, we had 10 20-yard dumpsters. City parks will help. We'll have skid steers, backhoes, gators, public. We'll have the parks employees, public works employees, community development employees. There's a lot of resource and time going in to making sure we keep some sort of stability in our parks. And the equipment really helps us because a lot of these items are very bulky. And so a dumpster will be full, but we can go in with a skid steer or a backhoe and just squish it down and fill it another 50% fuller. So there's a lot of money and resources going in to try to keep our parks clean. Next slide. And then during the cleaning process, of course, we are seizing and for safekeeping any items of utility. And you can see what those are. Those are tents and tarps, medication, toiletries, functioning, bicycles. Get a lot of electronics, a lot of personal stuff. So we are collecting all those items of utility, and those have to be collected for each camp. They have to be tagged properly, taken back to the police department, and then booked in as for safekeeping. And so that takes a lot of work as well. And then we also, it's important to note that when items are unsanitary or a biohazard, we are not collecting those. And so recently we've been seeing a lot more needles in our parks. And so those are things that now when we see needles in a tent, instead of trying to pick through, we'll take the whole tent and discard it. We've had several pokes. We had a needle poke yesterday morning. One of our employees got poked with a needle. And so they had one of the camps yesterday had 300 and some needles just scattered all over. It was wild. It was just wild. So things that are wet are getting discarded. We are seeing tents. So social service agencies are giving out. There'll be 7, 8, 9 tents, brand new, still in the boxes in some of these places. And so it's pretty crazy the hoarder mentality that we're seeing. Next slide. So we have to keep, when we do an abatement process with a posting, we have to keep those items of utility for 30 days. And I have a vehicle bay that we use for vehicles for search warrants. That gets full. We have an outdoor area, an open air area that we have to put for items such that could be flammable. So we seize lots of those propane tanks or cans with gasoline in them and things that can't go in enclosed spaces. So that's usually full. And then I had to buy 2 Connex boxes, and those are, in fact, I need more now. They're not keeping up. So we can do 100 camps in a day, and those will be clear full. And then I have to keep that property for 30 days. Owners of the property are able to come back during business hours and collect their stuff. But after 30 days, it's taken to the landfill. And so from the last 6 months of 2024, we took safekeeping from 220 camps. 45 of those campsite owners came back to get their property. And then of the 80% that was still left, it was over 10,000 pounds that we ended up taking to the landfill on after the 30 days were up. Next slide. Here's some of the needles and stuff some photos we took. The pictures yesterday were really, really revealing. It was wild how many needles were out there. This is from one on the Douglas County work crew filled all those containers at one of theirs, and I think they take them directly to the dump. They have some different way of disposing them. We take ours usually to the drop box that HIV provides, but we are seeing an increasing amount of needles in our parks. If you go to the next slide. The chart I put together, it shows, it's kind of hard to read, but it shows that it shows when people are picking up their property, what day. And so by day 14, there's over 70% of the property has been that was going to get retrieved, got retrieved. I put together a bill that we had Senator or our Representative Virgil Osborne try to push through the House, and it died. But we were trying to shorten down the days that we had to hold property from 30 to 10. And there's some other things as well, but that bill died. If you'll go next slide. I won't stay on these too long. These are some of the decisions that really impacted us. The Blake versus Grants Pass decision was following the first one that came out from Boise. This one here further restricted us and basically said that we couldn't impose criminal penalties for things that people biologically have to do, such as sitting, sleeping, or lying outside on public spaces. And then the Johnson versus Grants Pass, it went even a little further, and it prohibited civil or criminal penalties for those sitting, lying, or sleeping. And so that really kind of changed things even more for us. Next slide. And then on June 28th last year, the Supreme Court looked at those rulings and said, no, that's not accurate. It's not an Eighth Amendment it's not cruel and unusual to penalize someone for prohibited camping, essentially for sleeping in public. And so we were no longer prohibited from arresting, fining, or punishing people experiencing homelessness from sleeping in public. Next slide. And during this process, Oregon codified in 2021, Oregon actually codified what Grants Pass on the federal level had done. They took those, they kind of took the elements that from the Grants Pass ruling and they codified it into Oregon law. So even though the Supreme Court overruled what was happening and remanded back down to the federal level and said you can't do some of the things they had done, Oregon law already had it codified. So in many respects, we're still stuck with those earlier federal rulings now in Oregon law. Next slide. And this is just one of the statutes that defines personal property and requires a 72-hour posting. Next slide. And this is another one of the statutes that talks a little bit more about it. We'll go to the next slide. So as part of the Oregon law, we were in a position to enact time, place, manner restrictions. So the city council worked with the city staff and we put together our time, our place, and our manner restrictions. So the time when people could sleep and the areas, and we defined areas. We didn't define areas where they could be, because to do so, if we say you can be at this area, then if something bad happens, it's called a state created danger. And so there's some liability there. So we provided places in our public spaces where we told them they couldn't be, and then left out the places, left alone the places where essentially they could be, but we didn't tell them they could be there, but we just told them where they couldn't be. And then the time, you can see the times, go to the next slide. And these are the places, I won't go through all of them, but these are the places essentially where they're restricted from being. Next slide. And then the manner is pretty important for us, because we have now been we're now making because after the Supreme Court ruling, we're now making some arrests and for prohibited camping, and we're going into the parks that are and arresting really just the big disastrous, I mean the really gross campsites that are just large and really full of garbage. And we're seeing people keep their camps much tidier as a result, because they're realizing if they're the glaring eyesore, they're going to get the attention. So we are seeing some results there. Next slide. From 2019 to 2024, like I said before, then we were only able to enforce with a civil penalty. So it was a $250 citation, and the campers frankly didn't care about it at all. We could give them a ticket, they'd smile and talk with us while we're writing it. We still wrote them. It was important that we still were trying to do some sort of enforcement on our side, even though the courts couldn't really have an impact. And then in 2023, we started issuing failure to appear warrants when they didn't show up. So that was a bit of a shock, because they had been ignoring the tickets, and then suddenly there was having warrants if they didn't show up. So then people started to show up. And then in September of 24, we amended after the Supreme Court ruling from June, it took a little while to get our city ordinance amended, and we amended it. So the first conviction is not to exceed, for prohibited camping, is not to exceed $100. The second one is not to exceed $200. And the third could include incarceration not to exceed 7 days. And so the judge considers mitigating factors. Did they immediately comply when we went and said, hey, your camp's a mess, you need to clean it up? Did they clean it up and move? So that would be a mitigating factor. Did they seek assistance? Because we're trying to affect behavior. We want them to come to you guys, the social service agencies, and better themselves. And we have been seeing that. So we're really, that's our goal. And then have they used Roseburg Transitional Court in I'm not sure, gosh, Corey, 2019, 2020, I put together the Roseburg Transitional Court. And that's essentially says it's a system by which they go to court. If they're found guilty, the judge can kind of pause their sentencing, and they go to adapt, and they try to do something that would better their situation, and it's different for each person. So for some person, it might be 2 mental health sessions. For another person, it might be you get your driver's license or social security card or get a job or get into housing. Do something to better yourself and adapt reports back to the court, and then their sentence is commuted. So I've had that in place for a long time. There was really no incentive for people to use it, so people really weren't using it. So if they use the Roseburg Transitional Court, that is also a mitigating factor for punishment on this. Next slide. So as part of that, we now track, because when we're out in the field, we have an app that will track convictions. So as of today, we've had 87 offenders for prohibited camping have 1 conviction, 66 have 2, 20 have 3, 7 have 4, and 2 have 5 convictions. We have been seeing an impact. There used to be like over 100 of camps out at the point. Now there's 70 or 80. Officer Chavez, our homeless liaison officer, is saying that even out in the peripherals and some of the other areas, there's not very many camps. So we are seeing a decrease. And some of that is people are going to the navigation center. There was a guy, Josh told me about that was a hardcore drug user, and he was at one of Bernie's camps. He didn't know that till he showed up at one of the cleanups, and Josh was like, "What, get out of here! Get out of here! We're trying to clean." And he's like, "No, I'm here to volunteer." I think he relapsed and went back out in the camps, but as we all know, it can sometimes take a few touches there. But we are having impact. We are seeing that some pressure is causing some of these people to go even to the navigation center as well. People that Josh thought would never budge have been taking advantage of that. So we're hopeful. Next slide. And then also, because we are now able to arrest, we are doing that as well. So we will go in these massive camps. We will go in if they've had if they're already on their 3rd conviction, they are subject to arrest. So we are making arrest. When we do that, it's different. It falls under different parameters. So their property, then we have to keep for 60 days. So that's double the time we have to keep that property. And when we arrest somebody, they haven't had the 72 hours to move. Usually, you just show up and it's an arrest. And so we're encountering dogs, which we have to do something with their dogs. They haven't moved any of their stuff, so there's a lot more items of utility that we have to collect. They haven't had an opportunity to pick up their trash, and so it's just bigger. It takes quite a bit of time and quite a bit of resources. So sometimes you'll see on our log, if you get our police logs, you'll see that they were arrested, and sometimes you'll see that they were cited. If I only have a watch commander and 2 people working patrol, there's a good chance they're just going to issue them a citation. They can't get bogged down into a 3 or 4 hour cleanup. Yesterday they made arrests in 4 camps, and it took them almost 4 hours to clean the camps and get them all put away. And that was with Officer Chavez's help. So there's just a lot to it. ODOT. Sometimes the public gets kind of confused about why we're not doing something in different areas. For example, in Gaddis Park, underneath the bridge, if you look down the little ball field, you kind of look down underneath the I-5 bridge. That's owned by ODOT, and so they have to do the posting, and their posting is 10 days, and they have a different cleanup process, and they store it themselves. And so there's just, you can see there's under the I-5 bridge at Gaddis Park, Diamond Lake and Stevens, under the Washington and Oak Street bridges. There's just different rules for ODOT. So sometimes people get confused about, why we're not taking action or doing something, and it's not our property, it's ODOT's property. I think that's the last. Go to the next slide there. I had a lot of information and I talked really fast. I'm trying to get through it and I think I'm right at the 12:30 mark. I'd be glad to answer any questions. There's a lot more to it. I kind of skimmed the surface. But I'm talking to mostly social service people here, and I recognize that. So just know that our goal is not to make arrests. Our goal is not to issue citations. We would love to encourage, motivate, push, get these people to a place where they're helping themselves. But the people we deal with out in these camps, they will tell us they want to be right where they're at. If they didn't, there's space in Bernie's camps. There's definitely space in the mission. The mission director has told me he's never turned anyone away for lack of space. There's the navigation center is doing good things. There's Adapt is doing amazing things. Everybody will fall if there's someone that needs help. We find a way to get them help. Like there's so many people falling over themselves to help, to give them social service stuff so I can say with confidence that most of the people out there camping are right where they want to be. Now, I understand addiction and I understand all those things are playing a part in their decision that maybe they're making choices you and I wouldn't make, but they are there in a way that we can't move them and they want to be there, or they're choosing to be there, I should say. So happy to answer any questions. Like I said, I went really fast. There's a lot of information on those slides, and you're welcome to have them.
Gary, I just want to say, you're absolutely right, and it's a combination. It's a combination of all of the supportive services that a lot of the people in this room offer, and the negative pressure of the smaller repercussions for behavior that's undesirable in a society. And I appreciate your work, and I appreciate how much time and effort and energy your people put into that. And how gentle and compassionate you continue to be with our neighbors who are camping. So I appreciate everything that you do.
Well, and I guess it's, in layman's terms, what we always tell people is as the carrot and the stick, and I always want the carrot. Please take the carrot, take it. But we have found it is clear from the pandemic till now. The carrot will not move that needle. That will not get them to go. They're just not. So we have to do something different. And I'm not even saying the stick's the right thing, but I can tell you that our public here is demanding, the parks have some semblance of cleanliness and ability to access by other people. And I don't blame them. And we want that too. In the perfect world, time says they have to all be, collected up and be gone by 8. I don't have the staff to go do that. I can't do it. I don't have the staff. If I had a crew of 6, I suppose we could keep relentless pressure and we could probably do that, but my staffing is not such that I can do that right now.
Thank you, Chief. Gary, thanks a lot. I think that's a great presentation. Such a complex problem. I think we all recognize the problems, and there's no silver bullet to solve everything, and probably never will be. So I know you're doing a great job. Anybody else have a question or comment on Gary's presentation?
So I don't have a question. I just have a comment. I just have a comment that he gave a presentation last night. Roseburg City Council had a work study that the video should be on their government Facebook page for anyone that wants to watch what was discussed last night.
And that was very similar. I actually took this presentation and cut out a bunch of slides, and then Officer Chavez did it from more of his perspective. But along those lines, for all the community partners here, I want to thank you as well. Like Sarah said, it's a big piece of it's a big pie, and we're all taking a little slice out of it, trying to find some success. So,
thank you, Chief. Appreciate it. If any other questions, if no other questions for Chief Kloppenstein, we'll move forward to our next period part of the agenda, our disposition calls for service, January of April 2025 from Corey.
I sent that out, so I didn't know if you guys wanted to see it, but for 2025 so far this year, for the first 3 months, we've had 58 reports taken, or calls received, sorry. In March itself, it was 24 calls. The reports taken has been 7 total. So we only had 2 in March, and so far we've had 0 arrests involving calls for people with mental health concerns. So that's good. And still looking back 2 years ago, the numbers were quite different. But as we hear from Cheryl, her numbers are nice and steady and keep increasing with her program work. I did notice that Marion Pearson put a flyer in the chat. She also emailed it to me, so I will add that when I send out information to the committee from the meeting with the other information from Cheryl and Dean and Gary. And I just want to remind everyone, our next drug court graduation is Tuesday, May 13 at the Douglas County Fairgrounds at 5:15 p.m. Right now, we have 8 participants that are still steady and on track for that graduation date. Hopefully, we have all 8 there. That'll be the biggest one I've attended since being here. Usually during these grad processes, we lose 1 to 3 folks, not from anything major. It's usually a minor slip up, like missing the deadline for calling the UA line or late to an appointment. So we are that strict when it gets to this point, especially the last 45 days before graduation. They can't have any hiccups because at this point they should pretty much have their lives squared away and know the routine and what to expect with everything. And that's what we hold them accountable to. And if they slip up, then they go back to phase 4 and have to go through the grad phase again. Might sound a little harsh, but again, the judge feels it's necessary because sometimes that's also an underlying issue maybe that didn't come up to the surface in time. So we've found someone that missed an appointment, actually they ended up needing more treatment than they were really fully telling us. So we usually find there's a good reason when we get those little hiccups and they have to go through grad phase again. And it's not always a bad thing. So we like to celebrate. So we hope to maybe expand the room a little bit this time if we have all 8, which means a lot more family and friends. And I'm still working with Judge Johnson to see if he's going to have a guest speaker. Sounds like he might, but he doesn't have the plans finalized.
Okay, thank you, Corey. Any questions or comments anybody have? And I appreciate so much all of the groups that come together for this subcommittee and all the information that's shared, because that's exactly what we're here for, sharing of information. And I appreciate all of you that come and participate. And I learn so much every month from all of you. So thanks a lot. Any other questions or comments before we move forward? Okay, Corey, I think we're done then. And thank you, Chief, for coming along and giving the update on the homeless situation that you're dealing with, and appreciate your help and appreciate everybody that's here. So no other questions or comments. I will adjourn this meeting. Thanks, everyone. By the way, May 27th, Tuesday, May 27th is our next meeting. Same place, same time. See you later.
Thank you, everybody.
Thank you.